Around 300,000 people in the UK have reported having COVID-19 symptoms for over a month, but with still so much unknown about the long-term impacts of the virus, what do we know about long COVID? Although not an official medical term, long COVID is being used to describe coronavirus symptoms which last longer than 2 weeks, the period of time the World Health Organization says is enough for the virus to come and go. What are the symptoms?
My chest feels like someone's sitting on it.
I start having to live hour to hour.
Just feels like my lungs are on fire. Back in A&E.
The ongoing symptoms reported include severe fatigue, breathlessness, muscle aches, joint pain, brain fog, memory loss, and even hair loss. How long do the symptoms last? A study by King's College London found that around 300,000 people had reported symptoms lasting for more than a month, and up to 60,000 people have reported having symptoms for more than 3 months. What impact can the virus have on the body? A new research programme analysing the effects of COVID-19 has found that in some cases the virus could be responsible for significant organ damage. 79% of patients who've been scanned weren't hospitalised with COVID, but initial findings show that half of them have evidence of either heart, liver or kidney damage. Many had reduced heart pumping ability, 13% had evidence of liver inflammation, and 19% have evidence of liver fat. So how many of these symptoms were caused directly by COVID?
Admittedly, it's partly too early to say. We've compared a lot of our data against the UK Biobank data, but we still need more time to decipher how much of these are attributable to COVID-19.
Why is COVID lasting longer for some people? It's another current unknown. Whether patients have had relatively mild symptoms or whether they've ended up in intensive care with the virus, researchers are yet to find a direct correlation between the illness and these long-term symptoms. Is there a treatment for long COVID?
We will need to use a variety of different approaches for individual patients, and we would expect people to get better, but it will take time. And we need to be patient and understand that patients themselves will need to recognise that it will vary from individual to individual.
As researchers continue to investigate the long-term health outcomes of the disease, what help is available for people with long COVID? The NHS launched a COVID-19 rehab service last month for people who have been suffering with the long-term effects of the virus. The Your COVID Recovery Service initially launched online, but it will become a face-to-face portal when safe to do so.